Radio City presents Ask Maarga.
There are many other substances other than tobacco and alcohol which can lead to addiction. The next most common one being cannabis, used called as ganja, used as charas or as bhang. Another one is opioids, which people use as cough syrups most commonly, also as injectable opioids, which has a pain relieving action. People use stimulants such as cocaine, and people use some substances which gives them extra sensory abilities, leads to what is known as hallucinations called as ecstasy. There are many other substances which have multiple actions like magic mushroom, dendrite, most of which are known to have serious consequences when used continuously over a period of time, which can be treated at Maarga. The safety of these drugs come at a various level. Most of them are illicit, so if you are using it, it is not legal to start with. Continuous use leads to what is known as salience, where person only concentrated about procuring the substance and using them, leading to missing out on the life as such, leads to personal, family and social issues. They no longer have friends, have financial problems because they are procuring lot of substances, spending on these substances. Per se, the use of substances are known to have long-term medical complications and psychiatric complications. The mode of use, for example, if they are using injectables, then it is not sterile. They are at higher risk of getting infected at the skin level, at deeper level. Even heart can get infected because you are not using sterile injections. And psychologically, cannabis is proven to bring forward the date if at all you are prone to develop psychiatric illness. Say without cannabis, there are chances that you do not get it or get it after 10 years. Now that you use cannabis, you have it today, and also with continued use, it is known to alter how the psychosis will turn out. It may become more untreatable with the continued use of cannabis. Same applies to many other drugs like ecstasy, cocaine, MDMA and many other things. Thus, it is safe to keep away from all these substances. The various substances lead to various symptoms when they are overdosed. In cannabis, it may be hallucinations and delusions. In case of opioids, it may be seizures when it is very severe. In case of cocaine, patient may have symptoms related to heart and even stroke. And definitely the management will include evaluation, knowing what is the amount that the person has consumed, using, if at all there are any antidotes for the substance, using them so that the patient's life is not at danger. We at Maarga in the ICU, intensive care unit, do all of them, then manage the withdrawal symptoms, which at times are equally harmful to the life of the person, following which the inpatient care will continue. Rehabilitation, which is an important step which keeps person continued to be motivated to quit substances, helps them get back to life, their work, get back to their families. There is a risk of relapse, but what we need to know is it is an illness which is known to come back however motivated you are, however much help you take from the treating team. What you need to remember is to start the cycle from the beginning, come back, and we are there to help if there are relapses.
Radio City presents Ask Maarga.